Steve Taylor with Think HR and Insurance Services. Good benefits cost less when you know how it works. If your role requires you to onboard employees, you're going to get questions about how the employee health plan works. This can get highly personal very fast, and it's important you keep professional boundaries while still being helpful to people. So, in this video, I'll review how you can explain your employee benefits while maintaining that professional distance. And we're going to use the top 5 questions that a lot of the employers and HR teams that we work with ask us. So, let's dive in. So, employees, they usually want to know, hey, what is this health plan? What does it cover? Right? So the first thing you want to do is go over, well, what are essential health benefits? So with health insurance, the first thing that is covered are these items. So you got hospital care, visits to primary care doctor and specialists, outpatients procedures like surgeries and such. You got lab tests, you got pregnancies and newborn care, preventative and routine care, vaccinations, checkups, mental health, all those items, even emergencies. So again, like it's important to know what is covered in health insurance, and people sometimes can be bashful or very straight up with you and say, "Hey, I'm not really sure what's included in this." This is a comprehensive list of everything that's here. Now, one thing to note is mental health care. Mental health care in specifically states like California, they generally have to have about 50% or just same amount of services that they would have for any type of hospital or any other type of care that you see on this list. Why? Well, because they want to make sure that people's mental health is being taken care of. Mental health would be like, if you need therapy services, if you need, if you're going through, mental health conditions that require, you to see a therapist or to have special training or pharmaceuticals, that is taken care of by most plans in most states. So the essential health benefits cover these items. Once you know this, you can move on to the next question and see, we'll get into more details. But do I get free health screenings each year? So with the ACA, there is certain preventative treatments that you can get each year. And here's the list. So preventative care, the goal is for you to stay healthy, catch things early on as possible. So you'll see like blood pressure, diabetes, cholesterol tests, if you need routine vaccines or cancer screenings, vision and hearing for children, counseling for obesity. These things are generally covered by the ACA. Now, when it says these things are covered, that means that you're not paying a copay for these services. That means you're not paying towards your deductible. You shouldn't get any bill for these types of services. And if you are, then you can dispute them. Again, like you can go to healthcare.gov. It's a website, has a full list of preventative services. If you get a bill and you don't agree with it and you're being asked to pay it, that, hey, if it falls in this, you're covered. It's free. The next thing is, how do I know what doctors are covered? Well, you would look at the types of healthcare coverage that you have, and the types of coverage usually fall into PPOs, EPOs, and HMOs. All right. So, what's a PPO? PPO is very popular for most companies to have this as one option. So, you basically get to its preferred provider. Who do you want to go see? The network of providers will have an in network deductible and an out of network deductible. And the reason why you have in network and out of network providers is in network means they have a negotiated rate. The rate is probably a lot less for the insurance company, so they would prefer that you go with that person. As you see, like in cities or populated areas, there might be specialists that are highly sought after. Those people are going to go out of network because they don't need as many patients. In fact, maybe they need less. So it's not that you're going to get better or worse care. It's just that it really depends on the carrier's relationship with that provider. So you will be able to get covered for the services. However, you will want to check and see if that's going to go in the in-network cost sharing program or the out-of-network cost sharing program. That's what you want to focus on for a PPO. Now, an HMO, this one's a health maintenance organization. So think of Kaiser. If you're a Kaiser fan, this is how it works. So you usually do have a primary care doctor, and not just Kaiser has HMOs. Like Florida Blue, Blue Cross, Anthem. Like there is HMOs out there. But if you see a provider outside of your HMO network, they generally will not pay anything for those services unless it's either an emergency or urgent care. And you'll see that in the plan designs when you go deep into it. So when you're talking to your employees and they ask about, hey, is the HMO a good option for me? Then it could be, depending on how they use the services. But again, this is where it starts to get highly personalized, and you don't want to get into these conversations where somebody's telling you exactly how they plan on using the services or ailments that they have. That's not really a great onboarding experience, and you don't need to know that. You should actually refer them to the carrier, refer them to speak to their provider and see, hey, here's our insurance options, which one is covered. Also, generally, the carriers do have a lot of services, formularies, links to see if somebody is covered or not, and you'll want to check that out. So you always want to encourage the employees to look for themselves, especially with an HMO. Now, for EPOs, those are exclusive provider organizations. Now, you don't necessarily have a primary doctor. However, if you do go out of network, the EPO generally will not pay for any of the services, with the exception that, again, like an HMO, if you have an actual emergency or urgent care and you need to go to a specific hospital, you didn't have a choice, they generally will like take care of you there. But they do generally have limits on the types of like doctors or hospitals you can use, but they're not necessarily set up like a network. It's almost more like an in-network plan, and you do typically not need to get like referrals to go see specialists like you may in some in-network only plans, or in an HMO scenario. You basically do have a smaller option pool, and again, things aren't always covered out of network. Now, some plans are going to cover on EPO out of network, but you want to check specifically with your plan because all the EPOs are designed differently, and you'll want to look at that. There's probably only like maybe one or two options that you guys have if you do offer an EPO, but generally people are deciding between PPOs and maybe a HMO network most of the time. But if you are looking at an EPO, again, refer them back to the carrier and have them give their provider a call to see if they take that insurance, right? Because again, you don't want to get into too much detail there with them. Okay, so now we're looking at, hey, how much do I owe versus what will insurance pay? Well, here's some basic cost sharing terms that you'll see in insurance, right? So, cost sharing is just healthcare expenses that you pay for, and what does the insurance company pay for? So, co-insurance. A lot of people do understand co-insurance. It's the part of the bill that you meet your deductible, and then it might say 80% of the cost will be covered by your insurance company. So if you get $1,000 bill and you have a $500 deductible, you'll pay the first $500, and then you will split the next $500 80/20 with the insurance company. They pay, in that scenario, 400 of that, and then the other 100 is going to be on you to pay. A copay, that's like the flat amount that you go see when either you got a prescription sometimes, or if you go to see your primary care physician. You might see it with the specialist as well, or if you go to get acupuncture in network. A lot of times in network will have copays. Out of network may have copays, but most of the time it's like a more of the co-insurance. Your deductible. The deductible is the amount that you pay each year before insurance even starts to pay anything towards the plan. So usually the deductible, you have to fill this bucket up first before you get into the co-insurance piece. A lot of times copays may not be influenced by the deductible. Again, you'll want to look at your plan. You might have a copay plus an amount that goes towards your deductible. You want to check on that specific service and see exactly what it is you're getting from your visit with that provider. So again, here, so your annual out-of-pocket maximum. Now, I honestly feel like this piece is the most important piece that you can ask an employee to consider, right? You don't want somebody to feel like, man, you know what, I'm getting this insurance plan, and if the annual out-of-pocket maximum is $50,000, and they only make $75,000 a year, then like it's just honestly, it's like that might not be a great plan for them, especially if they have something like potentially like a terminal illness, right? If they have somebody in the family that may have cancer or be getting treatments that are quite expensive, you'll really want to point them towards this. Now, to keep an arm's distance so that you don't get into those conversations, because it's very easy for people to say, hey, will look like, which plan. I usually go with the most expensive one, but I know I'm not too sure, like, should I select this plan or that one? Just tell them like, hey, you'll want to look at the annual out-of-pocket maximum. That's the most money that you'll pay for in network, and then your out of network will also have an out of pocket maximum. So you'll want to have them look at those two numbers and see, can I afford that type of risk? Because the premium amount that's coming out, definitely coming out, the out of pocket maximum is the most amount that they'll pay. So they'll want to know that range so they can start to decide which services make the most sense. And the fifth most popular thing you get is, our clients will call us up and say, hey, our one of our employees is really confused about their bill. Why are they still getting bills from the provider? We actually like they went and got the service. They thought insurance was taking care of it. They already paid their portion of it. Well, a lot of times you'll want to look at the explanation of benefits. And this doesn't always happen right away. Sometimes insurance companies might give you an explanation of benefits, or you might see a bill paid or lingering, or you might get something in the mail from, gosh, like, 8, 9, 10 weeks ago, sometimes even 12, 13 weeks ago, right? Because a lot of times the providers will send you the bill, and then they also send it to insurance. Insurance may make the claim or make part of it, and then the bill comes back to you. You call up the provider. So there's a lot of things happening there. And what you want to do is you want to guide that employee to, hey, here's what an explanation of benefits does. It shows you the billed amount. What did the provider bill you? It'll also show you the allowed amount, right? If the bill is higher than what the insurance company does allow, the insurer may give you a discount, they may not. There could be a lifetime maximum to a benefit. There could be a lot of things in the plan, but this explanation of benefits has to be clear and to the point and make it super easy for anyone to understand, how did that billing work? And you may find that the employee is frustrated because they're in between their provider and the insurance company, and they come to HR, they come to their manager asking for help. You have to just go ahead and explain to them, hey, the explanation of benefits, that's what the provider must walk you through as far as how they build it. And as far as the insurance company, they're going to have to substantiate why they paid what they paid. And then you're going to have to go back and look at finding a way to resolve that claim between those parties for yourself, or for the employee at least. So again, like, if you're working with an employee and you're not sure how to explain it to them, you just got to tell them, hey, you got to look at the explanation of benefits. It'll go over this entire amount. It'll show you the patient's responsibility. And a lot of times, look, if it ends up going way over what they estimated, generally, if you keep being persistent and you encourage the employee to continue to talk to the insurance company and the provider, at some point they do right by the customer and make sure that they're taken care of, but not always. But this explanation of benefits is the key to having that conversation with either party at all. Hey, thank you so much for watching this video. Look, it can be challenging when you have an employee and they're eager to onboard and learn, and they ask you some of these questions. A lot of times, founders, leaders, you want to dive in and be helpful, because it's absolutely feels good to be able to help them out. Again, these conversations specifically around health insurance, they can get very personal very quickly. So you do want to maintain a professional distance. And the way you do that is by educating the employee on how plans work, so that they can better assess their own situation. And you want to almost like guide them to, hey, how do you look at the plan designs? How do you contact the carriers? How do you look at an explanation of benefits, and who can you get in contact that has to walk you through those things? Again, if you need more support or training on this, this is something we do for our clients all the time. Feel free to book a strategy session with us, and we'd love to be helpful in any way. All right. Take care and best of luck.